I'm Stephanie Ruhle, and I am joined by another expert in the field of public health, Dr. Tom Frieden, former head of the CDC, current CEO of Resolve to Save Lives. Tom, always good to see you. So much to talk about, but we have to start with this big Pfizer news. What's your first reaction?
Well, first off, it's really encouraging. I don't think anyone expected the vaccine to have a 90% plus efficacy, and the FDA has now reanalyzed all of the data and confirmed it, so that's great. Unfortunately, it's going to be a long time before we have vaccine widely available. That's why right now, what's most important is to double down on protection protocols.
I want to stay on the vaccine just for a moment. The fact that the efficacy rate is so high, do you think this is going to help with the PR battle? America's confidence or their concerns in the idea of taking this vaccine?
It's really encouraging. I think if you ask people to take a vaccine that's 50% effective versus 90% plus, people are more likely to take the 90% plus. But rolling out a vaccination program is extraordinarily complex, particularly for the Pfizer and Moderna vaccines. They're 2-dose series, finding people 3 or 4 weeks later. And also, it's not that it's completely benign. You're going to have a sore arm. You may feel bad. You may have fever. And those numbers were just released in the FDA review of the Pfizer data. So we can tell people this is the likelihood that you'll have a fever or feel bad or have a sore arm.
Let's talk about that. I myself right now, I'm recovering from COVID-19. I tested positive, my husband and my children. And I want to talk to you about testing because 11 months ago, you and I were talking about the importance of testing. Why is the turnaround time days?
We still see the lack of a coherent, coordinated federal strategy. It's challenging to scale up testing. There are new antigen tests, which aren't quite as accurate, but may have an important role in people who are contacts and others. And really, a lot of it, Stephanie, is about money. If we simply told the large companies that tests that take more than 48 hours to come back are of very little value, and so we will pay little or nothing for them, they may be able to do a better job, or at least not make the charade of doing a test so that we can say we did 1 million tests when 500,000 of them had little or no value.
I know it seems crazy to think about the next pandemic, but I want to share what 2 former fellow CDC directors said the agency, the CDC, needs to do right now to prepare for the next one. Take a look at this.
CDC has to make sure all of its data systems are able to collect data by race, ethnicity, gender, physical ability, zip code. CDC has to view dismantling systems of structural racism as part of its mission. It has to draw the connection between racial equity, racial justice, and health.
The CDC must continue to prepare leaders who care enough, leaders who know enough, leaders who have the courage to do enough, and leaders who will persevere until the job is done.
What do you think?
We need to invest in public health at the national level, state and local level, in cities, and globally. We need to do whatever we can do to take a preventable pandemic off the table.
Dr. Frieden, thank you so much for joining us today and always for sharing your expertise. Every time I speak to you, you make us smarter and you make us better.
Thank you, Stephanie. It's always a pleasure speaking with you, and I hope you continue to improve steadily, and thank you so much for sharing your story.